My leg. I can't walk. I can't walk. Call me an ambulance. Call me an ambulance, please. How much is it? No, I'm good. I'll manage. Damn it.
Chris, just a delightful phone call in every way. And while I appreciate the call, let me actually answer the question pretty clearly. So first of all, the idea that poor people in the United States are dying for lack of care is simply not true. In fact, there is Medicaid that is available for a huge variety of people who are low income in the United States. The idea that we have a completely privatized system is nonsense. We have Medicare available for people who are elderly. Also, we have emergency care available for everybody by law.
All right. You heard what he said? Let's look into it. Just FYI, a lot of my information is from back in 2018. There's some 2019 stuff, but it's so scattered that I decided I was going to stick with 2018 because I can find in the vast majority of everything that I have in this video all the data for 2018, and also it shows either small inclines or declines, so I figured it's not going to be much difference 2 years later. So let's look at something real quick. For example, those enrolled in Medicare. You see in this chart, if you can see it at 2018, mind you, this is all set up in the millions of Medicare enrollment by age group. In 2018, less than 10 million individuals were set up for Medicare. Those 10 million or less than 10 million are individuals who are under the age of 65. So if we're taking that into account, right, less than 10 million of individuals in 2018 under the age of 65 covered by Medicare. Well, check this out. In 2018, the population of America in poverty by age has children 0 to 18 at 13,547,700. So if you round it all up, 13.6 million children. That doesn't cover the 10 million that are under 65 covered by Medicare. Not to mention the adults who are in poverty between 19 and 64, 23 million. Something to consider is that even if we get these 10 million, right, and we cover as many children as we can, we're not covering all the children. Not all the children who are poor are enrolled under Medicare. And then adults between 19 and 64, there's 23 million. Which I'm curious to know. I wasn't able to get the information specifically, but how many of these 23 millions or these 13 million in 2018 were covered under Medicare? And something to also consider is that if the children are getting all the Medicare, like hypothetically speaking here, that means that the adults weren't on Medicare, needed to pay out of pocket. These are people in poverty having to deal with medical expenses.
Second, the idea that life expectancy in the United States is dramatically lower than that in Canada neglects to actually adjust for homicide and car accident death. When you do that, the United States has the longest life expectancy, including in Canada.
So I found some of the information interesting. He pointed out the homicide rate and vehicle fatalities, and about the overall life expectancy in the United States. Now, whether or not we want to talk expectancy or what specifically goes into what makes life expectancy longer, I figured let me go double check to see what he was talking about in regards to homicides and vehicular fatalities, right? This is what I found. So we're going to talk homicide US versus Canada, right? Again, we're going to go with 2018. This is the population of the US, 327.2 million in 2018. Put the 2019 there just for comparison of it, the slight increase. Canada, you have 37.06 million in 2018, slight increase in 2019. I'm mainly putting this 2019 stuff just so you see it's a slight increase. So even if 2020 ends up being slightly increased, it's not outside of the wheelhouse, and it's not really that much of a major change for the purpose of what I'm about to say. So what is the difference between population, right? So I just took the 327 divided by 37, got 8 point blah, 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 or I rounded it up to 9, right? 9 times the population US has compared to Canada. So let's talk about total homicides. And in 2018, USA had 16,374 total homicides. It's a 5.3 per 100,000 population. Canada had 651 in 2018, 1.76 per 100,000 population. I was having trouble actually trying to find something more recent, like in 2019. So this is all I have, but let's go with it for now. So you have, again, let's see how much it would be if Canada had a population of the US. And we multiplied it by 9, got 5,859. That's over a third of the deaths in the US. Something to understand is this is a way super simplification of the situation at hand. Because when we talk about homicides, one thing that Canada and the United States have that is different, right? Something that needs to be calculated into this situation is how many metropolitan areas does the United States have in comparison to Canada. A lot of metropolitan areas in Canada have like 10,000, 20,000, 30,000. America has a ton of metropolitan areas that are population of 200,000 and greater, right? So a lot of the crime, that part you can do your own research, man, because I need to go to bed. But the vast majority of crime, if we go look at the FBI statistics, majority of the crime comes from these metropolitan areas. That's where the homicides come from. And so we can all argue like a cultural thing, and maybe there's something we need to do to focus in these metropolitan areas in order to make them better for the American people, to lower homicides. So now let's talk motor vehicle fatalities. US, we had 36,590 in 2018. Canada, 1,922 in 2018. So even if we inflated Canada's population, we're still talking about 17,298 fatalities if we were to increase the population of Canada to the United States. Now, again, this is an oversimplification. For example, like we talked about, this being a thing with metropolitan cities. I am not exactly sure what's the difference between the United States and Canada when it comes to motor vehicle fatalities. So I can't really say much along the matters of that. But if we look at the data, even without bringing this up, which is why the only reason I did this whole thing with inflating Canada's population is because I was trying to find out in what way does Canada have a higher issue than the United States? Because in these situations, it has nothing to do with really the medical care or the quality of medical care. When it comes to homicides and motor vehicle fatalities, we're talking about culture, not the culture of these countries, not the lack of medical coverage. I wanted to bring up some more talks about like health coverage with Steven Crowder, and this is what he had to say.
Right. Life expectancy isn't directly tied to quality of healthcare, but also self-care. Okay, right, we have a much higher obesity rates here in the United States, and a much more diverse demographic than say people who are about all the same height, size in a place like Norway with the population of Rhode Island. Okay, Now, something else. World Health Organization, they put a lot of weight on disability-adjusted life years. What does that mean? It means it completely ignores countries that keep disabled people alive longer, like the United States. Infant mortality. That's actually measured differently across different countries, like we've talked about with violent crime rates. We actually count infant deaths in the United States, which would not be registered in other countries because of our higher standards of healthcare.
So when he talks also about infant mortalities and how some countries don't count them, I wish he told us which ones those were. How many countries, or I hate to say this, but developed countries are the ones that don't count infant mortalities, and what exactly it is that they label as infancy. Because we all know here in the United States, we have a large portion of the population who counts a life at conception. And we can argue all day long about that, but just bringing it out that we have life at a conception. Reminds me of the comedians. It's like, are we going to start counting all the dead sperm while we're at it? But when it comes to those situations, I wish he gave us more information. He doesn't offer his sources. So that just irks me a little bit. But let's move on.
If we do some standardized comparisons, objective numbers, this is one thing that's funny from the left. They go, if you look at facts, okay, well, let's look at facts.
Let's do it.
Compare numbers, United States, UK, Canada, since UK was rated #1. Do they actually offer better quality care? It's not even close, okay? We have over 9 times the MRI machines of Canada, for example.
We like to collect them.
That's the empirical. I can give you the anecdotal. My mom was going to have to wait 1.5 years for an MRI because she ruptured a disc. But that's what they call in Canada elective, along with serious dermatology, neurology. That's another thing we'll get to in a second.
I waited 50.
All right, folks, he really opened the floodgates for me, trying to say that the count of MRI machines is somehow an indicator of the quality of healthcare in the United States. Well, it's not, okay? Let's look at the health system tracker, Pearson KFF. And this FYI, this was posted August 12, 2020. Now, a lot of the information in these charts skips time, so I guess I'm not the only one who has trouble finding more current information. But we're going to see real quick, fewer acute hospitals, America, not #1. All right. Fewer physicians per capita, America, not #1. #1 with individuals with specialist care over generalists. I'm not sure that's a good thing. I'll have to look into it. Psychologists, America, not #1. Psychiatrists, America, not #1. Socialists, #2 in this 5 country list. Nurses, not #1. Just FYI, this is 2016. I'm not exactly sure how different this is compared to current events. 2018, United States, not #1, #3, I suppose, is good enough. United States, MRI machines. This must be what quality of healthcare. So much better, so much better. Here's Japan, though. If you also go through all of this on your own, you're going to see Japan on the top of a lot of things. I'm going to mention that for a reason, but hopefully I have enough time. If not, there will be links. I would like everybody to look at the Japan stuff in the description below. Do a little bit of your own homework. Let's keep on going, though.
15 minutes, by the way, from
yes,
the MRI.
I know.
I literally walked in, got it,
because
and
of
left.
evil private insurance companies. By the way, your likelihood of dying from prostate cancer, breast cancer, myriad terminal illnesses doubled. That rate is doubled if you live in the UK, New Zealand, Germany, and Canada compared to the United States. And this is something too.
And
they say,
bad teeth.
why if you don't support socialized healthcare, why don't you care about the 40-something thousand people who die without access to care? Well, why don't you care about the 100% increase in women who will die of breast cancer?
Okay, folks, this is the part that pisses me off when individuals talk about facts but don't really present the facts to us. Like, for example, how exactly is it a 100% increase to the death of breast cancer in other countries, right? Let's talk about United States and the UK. First of all, let's look at the best case scenario here in the United States, right? An invasive cancer is located only in the breast. The 5-year survival rate of a woman with breast cancer is 99%, right? That's if you find it early. So, but what happens, worst case scenario here, folks? Let me see. If the cancer is spread to the regional lymph nodes, the 5-year survival rate is 86%. If the cancer is spread to the distant part of the body, the 5-year survival rate is 27%. 27% compared to the 99% if you catch it early, right? All right, let's look at the UK. The common cancers included in the analysis, breast cancer had the second highest 1-year survival rate, 96% for women. After melanoma, the skin, for 5-year survival, this figure was 85%, right? Whilst those diagnosed with breast cancer at stage 1 have a 100% chance of surviving for 1 year after diagnosis, 66% diagnosed at stage 4 will be alive 1 year after diagnosis. Worst case scenario, 5-year survival for diagnosis with stage 4 breast cancer, 28% in the UK. So when Stephen Boy decides he wants to give us the facts, I think somebody mixed up his memos, because I don't see the correlation here, or again, where are his sources? He just showed us one picture, and who exactly posted that article? Oh, everybody who's still around, I appreciate it. Thank you for sticking through. So really quick, I'm gonna hopefully give out all the information I wanted to mention about Japan. Like, for example, in the health system tracker, Japan was on top of a lot of countries, and I believe the population of Japan is just a little over half of the United States, and they have a lot more things better than we do. Now, it's a lot more complicated than the situation. It's not an easy fix is to adopt Japan's system to ours, but there are a lot of things that Japan does that is a lot better than the United States. And I want to go through them real quick, and let's go. So again, this is back in April 2018. It's a Snopes fact check about healthcare in Japan. They had a mixture, and there's really only one thing that they had to correct. It's not even like they had to do everything. Where these 6 points: 100% of Japanese have healthcare insurance. Costs are half of what we spend in the US. Japanese can choose their own doctors and see them twice as often as Americans. Japanese have the world's longest life expectancy and the second lowest infant mortality. 95% of Japanese healthcare is not for profit. The government sets all fees for medical services and drugs. All right. Point 1, this is basically true. I'll put the link below. You can look at it yourself. Cost of half of what we spend on healthcare in the United States. By the two most commonly used metrics, this is about right. Okay, Japanese can choose their own doctors and see them twice as often as America. Japan has what is known as a free access system, which means, as the Mimi correctly states, that for the most part, patients can use whichever doctor and hospitals they choose. Number 4, Japanese have the world's largest life expectancy and the second lowest infant mortality. This is true. Number 5, 95% of Japanese healthcare is not for profit. We do know that the law hospital Japan cannot operate for profit, with the exception of large for-profit companies who build hospitals for their own employees. 80% of the hospitals are privately run. Facilities that provide care for elderly and disabled people can operate for profit, and according to Matsuda, most do. The government sets all fees for medical services and drugs. That is true. All right, folks. I think I'm going to leave it at that. There's extra links in the description section. There were parts of this video I wanted to add, but it's going to make it too long, so I decided not to. But I kept the links in there. I tried to label them as best I could. There's some extra links for Japan to augment what I added to what I just finished saying. Other than that, again, thank you for sticking around. Been a message from your national idiot. Have a good one. Stay safe.